My name is Sandro Galea. Welcome to Public Health Ideas. I serve as Dean of the WashU School of Public Health. And today I have the privilege of speaking with Professor Amy McQueen. Dr. McQueen is a professor of public health at the School of Public Health. We're going to be discussing Dr. McQueen's work on shaping better approaches to health communication. Amy, welcome. So lead us through a little bit your work. So, you're working in some areas that are pretty current right now. How did you come to be doing this work, and what are the central questions that animate what you do?
Yeah, so my main focus has always been on health behaviors, so that sort of runs the gamut of various topics: cancer, heart disease, you name it. In grad school, my first health behavior that I focused on was actually binge drinking among undergraduates. And one of the things I took away from that was that even when people are doing something that they know is bad for their health, they often will pat themselves on the back and say, oh, but I don't smoke. So that's okay, right? I think there's this unique human trait that allows us to always feel pretty positive about ourselves. And that's really necessary and adaptive because it allows us to, be positive, engage with the world, be productive, but it also allows us to create barriers or defenses against information or recommendations that might threaten that sense of positive positive well-being. And so that's where health communication is important, because we often have to tell people, it's not just don't smoke, it's also don't drink to excess, get some exercise, get some sleep. And thinking of creative ways to make people sort of accept that and adopt that as part of their positive self-view.
So let's build on that. So what motivates what the choices people make about their health, and how do those choices intersect with the world around us? And what does all that mean for health communication?
Yeah, that's a long answer. But I think just a few things to keep in mind is that there's always the individual within the context or the social. So that's a great question, because we always have the interaction of the two. We need people to see themselves as vulnerable to things like cancer in order to engage in the health behaviors and the cancer screenings that we encourage them to do. That perception of risk comes from awareness and knowledge and the ability to synthesize that information and act on it. We know that not everyone has the same health information environment or the same skills at distilling what's important for me and when. So both the individual and the environment are really important. And that's true for social norms. We often want to follow the people who are around us. Our close friends and family sort of help influence our behaviors. But we know that can be harmful to us if they are all smokers. And that's what we see, is that people who are trying to quit, they have a lot harder time if they live with another smoker, or if most of their friends are smokers, because you have to not only change your own behavior, but the whole context that you tend to live in.
What is the top line you take for health communication from this notion about what motivates us and how it intersects with the world around us?
Most communication is about knowing your audience. So I would say engaging and understanding, doing a lot of deep dive into who's affected, what's the message that we want to deliver to them, and then engaging with them in a way that understands their side of things. So most people I've talked to who smoke, they want to quit smoking, but that doesn't mean they want to be told to quit smoking. Right. They want to talk about it. They want to discuss options. They want to tell you about what's worked in the past, and they want to help, or they want to also talk about how to plan for it, because you can't just decide tomorrow. Well, some people do.
Yes.
But there's often plans and avoiding the stressful things they're expecting in their next week or next month. And so just sort of engaging your audience and finding what will motivate and what values and goals they have is the best part of, I think, crafting the right communications.
Let's go to COVID, because you studied something which is sort of quite a hot topic right now, which is trusted sources in promoting COVID vaccination. So what was rated most trustworthy and why?
Doctors are almost always rated very highly, so they were consistent throughout the pandemic. Other social service agencies, probably because we were recruiting people from 211, a lot of people rank them positively in terms of solid information source. CDC and other government agencies were initially rated very high, and in our qualitative interviews, they lost favor over time. So even among people who were really following them, trusting in them at the beginning, the changes over time or inconsistencies in messaging over time is what caused like a big lack of trust. So people are often very anxious when things change. And I think then they turned to people who they could have more interaction with. So people talked about reaching out to their neighbor who's a nurse, or their sister who's a pharmacist. And so they mentioned all these people in and around healthcare. My son is studying statistics. And it just illustrated being a health adjacent expert was good enough, and then someone you could ask questions and maybe help understand the information that you've been able to amass yourself. A lot of times people also looked for more than one source, which is smart.
What did we do right? What did we do wrong?
Probably a lot of things. Two things.
On both sides?
Right and wrong, yeah. But I would say two things that I wish we continued. I think we did well and we're not doing now. One is, even in our local environment, all the hospital systems really started communicating, working together, sharing data, doing joint reports and committees and all this sort of stuff. That was so inspiring and so interesting to listen to how different groups were handling things, and you could learn from each other. And I don't think we do that anymore. Also, I would say never have we had such a daily dose of health information and health communication on every news program, whether it be TV or radio or podcasts, on every talk show. There was always some type of leader, whether that be health related or government related, or some local person who could talk about the state of the health or what to do or whatever. And health communication in that case was used as sort of a reactionary and an acute dose of let's deal with this. But as soon as the vaccines were pretty dominant, we were starting to go back, starting to not have to mask, all that sort of investment and that attention to health as a daily topic, went away. And so that, I just think of it as an investment. Now, obviously, we don't want to have to talk about one particular health topic that much, maybe ever again.
Yes.
But
right, but I think it's a fair point. Yeah.
Just the daily dose, the daily access, seeing government officials, healthcare providers, epidemiologists, never, I don't think, has someone like Dr. Fauci become a household name. A household name. So
let me go to a couple of your papers. So I'll go back to about 10 years ago. You had a paper about graphic warning labels on cigarette packs, and you wrote, qualitative findings underscore the need for warning labels that encourage self-referential processing without increasing defensive reactions. So I think this notion of communicating in ways that do not make people defensive feels to me like an effective way of communicating. So how can we engage in communication and in communities in ways that do not trigger defensive responses?
Yeah, and I think there's, extreme, opposites. So our usual approach is to provide very factual, boring, bland, health facts or information that doesn't seem very personal and doesn't necessarily engage people, kind of the school book, approach. The graphic warning labels are much more in your face, scary, fear-based, and are sort of meant to shock and awe, which can be effective, but then also often have a lot of negative reactions. So not to say both aren't appropriate in their use, but certainly better understanding of when people are defensive, what are the more effective or engaging health communication strategies we could use. So if people discount the information or the source, it might be because we're not presenting both the pros and cons of an issue, vaccination, for example. If we're only presenting things as very rosy and perfect, and this is the one thing you should do, and there is no deviation, then anyone who is skeptical or questioning, the evidence has only to push back. Where if you present all the information that we have and allow people to sort of see the good, the bad, whatever, and make that choice, there's less sort of need for defenses. There's also, for cancer screening, people feel like, it's something I can do later. So if there's not a perceived immediacy or severity, they can have good intentions for a really long time. So having maybe some narratives, some stories where people say, hey, I caught it early. I wasn't thinking this was even relevant for me, but I went ahead and did that colonoscopy, and boy, it was really, fruitful. So there's, different strategies. Also, when people feel really manipulated and that the government is overreaching and they're pushing back on because of that, again, having that information come from a different source, having it come from social, influencers maybe in their environment. And then also encouraging them to look at the facts, look at their own information sources, and consider their own values and how this probably actually fits within their own values, regardless of whether the government likes it or not.
Let's move to a different study, which builds a little bit on that, but I just like the study. The effectiveness of humor, cute animals, and coping messages. So tell us a little bit about this study, its takeaways for health messaging. Talk to us about the role of humor and cute animals in effective communication.
Yeah, so as you can imagine, we're always looking for new strategies. This is actually a study from a friend of mine and colleague, Heather Oram at University of Buffalo. And she's focusing on people who tend to be avoidant of health information. So it's their self-reported tendency. And it's building off work in the past where there's more laborious sort of time-involved ways of helping people think about their positive self-views and the good things and their values in order to prepare them perhaps or make them more open and engaged with risk information. And so this idea was, can we prepare people to better engage with what might, be less exciting or less interesting, risk information. Also, what was unique was that instead of trying to prepare like a risk message about colon cancer in a funny way, she, presented humor before introducing the topic. And same thing with the cute animals and also messages to support people's coping mechanisms. Only the humor increased people's likelihood of engaging with a colon cancer screening risk calculator to see, kind of what's your level of risk, or engaging with a colon cancer educational video. So we know that humor was effective, but it can't just be due to positive mood, putting someone in a positive mood, because then hopefully the cute animals would have also done that too. So we're looking more into that mood valence and how that changes for people who tend to be more avoidant than others. So we'll stay tuned on that.
Penultimate question. So we've been having a lot of conversations lately about the decline in public trust in experts in general, public health specifically. So what are your thoughts on rebuilding the trust?
Okay, I'll give 2 answers for that one. The first is, I think, again, the investment in the health information ecosystem. And Matt Kruder, from the Health Communication Research Lab, has been working on that through iHeard, trying to boost the, reliable and accessible information that people are interested in, different health topics or questions. So I think that's something we can do, is help, boost sort of the availability of trusted and useful information, and then send it out through different channels. The other thing I think we really need to work on, both sort of socially but also within the health system, is helping people deal with a certain amount of uncertainty. There's much of what we know is sort of based on accumulating evidence, and there's always a mix of pros and cons. There's a mix of significant studies and null result studies, different studies with different samples, and there's just a lot to synthesize, and that's sometimes harder to appreciate and harder to make sense of, and people kind of push for just tell me what I need to do, or just tell me the answer. Doctor, what would be the treatment or the surgery that you think your mom would want in this situation? But often there isn't always one answer or one best thing. So if we could really train all of us to sort of engage with information, talk about it, so that it doesn't seem like we're always shifting our answers depending on this study or that study, or how different pros and cons are weighed.
Yeah. I'll end with a positive. Hope. What gives you hope in this moment?
That someone else will figure out these things, not just me, but also I think what brings joy is collaboration. So different perspectives, different people working on problems, chipping away at things from different angles or in different settings. I think that's what makes the work enjoyable and something that we keep coming back to through collaboration.
Thank you. Thank you for talking. Thank you for
Sure.
everything you're doing. And thank you for joining us.